Greetings, ladies and gentlemen. I offer you the next installment in my video series on libertarian life extension reforms. The fifth proposed reform is reestablishing the two-party doctor-patient relationship. The most reliable and effective medical care occurs when the person receiving it has full discretion over the level of treatment to be pursued, while the person delivering it has full discretion over the execution, subject, of course, to the wishes of the consumer. I see a libertarian approach to healthcare as the one most suited toward ensuring that every person obtains medically necessary care at an affordable cost. A libertarian system respects and does not violate the sovereignty of either the consumer or the provider. It is important to make sure that no third party, whether it is a government or a private company, is able to deny the treatment that can save a person's life. In other words, there should be no rationing of care for which a patient is able and willing to pay, and which a doctor is able and willing to provide. Furthermore, there should be no situation in which a political system prevents physicians from exercising their right to provide charitable care free of charge, or care at a deep discount to those who could not afford it otherwise. For instance, Medicare in the United States prohibits doctors who accept its reimbursements from treating patients free of charge. This cost-imposing prohibition, among many other restrictions on the provision of care using innovative methods, should be abolished. Consumers should be completely sovereign regarding the healthcare techniques and systems they utilize and the methods of payment they prefer. This recommendation is premised on the understanding that most people want to live, and most people want to prolong their lives, and when given the freedom to do so, they will take appropriate action. No person should be mandated to participate in a system of healthcare or payment which he or she does not personally prefer or consider worth the costs. Experimentation should occur with a wide variety of arrangements for providing healthcare. In the United States, innovative approaches are currently being pursued on the West Coast and elsewhere, with clinics providing basic medical care, not on a fee-for-service model, but based on a monthly subscription, which entitles the patient to care as needed, as well as extensive in-person and electronic consultations, which are not typical of the labyrinthine medical systems that prevail in the Western world today. Other possible approaches could include systems of tiered pricing, where a doctor is free to charge patients of fewer means much lower fees than wealthier patients are asked to pay, or a system where prices for services are itemized and disclosed in advance, as in a menu, so that patients know in advance how much the care they seek will cost. Freedom in pricing and structuring healthcare businesses will also enable the much heavier utilization of rapidly improving electronic technologies at lower cost. It is essential that political barriers do not stand in the way of experimentation by physicians and patients regarding the provision of potentially life-saving healthcare, because just as no central planner can foresee the scientific discoveries that will ultimately save and extend lives, so can no central planner foresee the most efficient and effective ways of delivering such care in an abundant and affordable manner. Forcing people into any system of healthcare, private or governmental, which they do not voluntarily accept, will only hold back medical progress and result in widespread tragedy and colossal waste of life. In countries where the government predominantly pays for healthcare, the most important reform is to render participation in the government system voluntary. The worst systems of government healthcare are those where private alternatives are prohibited, and such private competition should be permitted there immediately, with no strings attached. Better yet, patients should be permitted to opt out of the government systems altogether by being allowed to save on their taxes if they renounce the benefits from such systems and opt for a competing private system instead. Over time, the government systems would shrink to basic so-called safety nets for the poorest and least able, while standards of living and medical care would rise to the level that ever fewer people would find themselves in need of such safety nets. Eventually, with a sufficiently high level of prosperity and technological advancement, the government healthcare systems could be phased out altogether without adverse health consequences to anyone, and hopefully, by that time, we will already have either indefinite life extension, or at least life extension to time frames that are not encountered today.